1. What is the primary responsibility of a nurse leader in delegating tasks to nursing staff? A. Ensure the task is appropriate for the staff member. B. Assign the task to the most senior nurse. C. Avoid delegating tasks to untrained staff. D. Delegate all tasks to the nurse on duty. Answer. A. Ensure the task is appropriate for the staff member. Rationale. The primary responsibility of a nurse leader in delegating tasks is to ensure that the task is within the scope of the staff member's capabilities and training. The other options are not appropriate, as delegation must be based on competency, not seniority, avoidance, or overdelegation. 2. A nurse is leading a healthcare team in a busy unit. Which leadership style focuses on directing the team through clear instructions and rules? A. Transformational leadership. B. Laissez-faire leadership. C. Autocratic leadership. D. Democratic leadership. Answer. C. Autocratic leadership. Rationale. Autocratic leadership involves directing the team through clear instructions and rules, often without seeking input from others. The other leadership styles are more collaborative or participative in nature. 3. Which of the following actions best demonstrates patient advocacy in nursing practice? A. Making decisions for the patient without consulting them. B. Ensuring the patient's rights and preferences are respected. C. Prioritizing the nurse's tasks over the patient's needs. D. Ignoring a patient's concerns about their treatment. Answer. B. Ensuring the patient's rights and preferences are respected. Rationale. Patient advocacy involves supporting and promoting the rights and preferences of patients, ensuring they are well-informed and involved in decisions about their care. The other options violate patient rights and autonomy. 4. Which of the following is the best strategy for ensuring effective communication in a multidisciplinary healthcare team? A. Only communicate when necessary. B. Use technical jargon when speaking to team members. C. Hold regular meetings to discuss patient progress and concerns. D. Encourage team members to communicate individually with patients. Answer. C. Hold regular meetings to discuss patient progress and concerns. Rationale. Regular meetings allow for collaborative communication and ensure that all team members are informed about patient care. Option A limits communication. Option B can create confusion, and Option D lacks coordination. 5. Which of the following is an example of resource management in nursing? A. Assigning tasks based solely on staff seniority. B. Prioritizing patient care based on urgency and available resources. C. Allowing staff to work independently without oversight. D. Ignoring patient load and focusing on individual tasks. Answer. B. Prioritizing patient care based on urgency and available resources. Rationale. Effective resource management involves prioritizing care based on urgency and available resources. The other options do not address the optimal allocation of resources for patient care. 6. In managing patient care, which action is most important for ensuring safe and quality care? A. Focusing only on completing tasks rather than patient outcomes. B. Encouraging patients to manage their own care without assistance. C. Ensuring continuous assessment and monitoring of patient progress. D. Reducing the number of staff to save on hospital costs. Answer. C. Ensuring continuous assessment and monitoring of patient progress. Rationale. Continuous assessment and monitoring are essential for ensuring patient safety and quality care. The other options either compromise patient outcomes or focus on cost over care quality. 7. When allocating resources, the nurse manager must consider which of the following? A. The most experienced staff members should be allocated to all tasks. B. The patient's needs and the available staff skills and resources. C. The hospital's financial situation only. D. Delegating tasks to the least busy staff members. Answer. B. The patient's needs and the available staff skills and resources. Rationale. Resource allocation should focus on meeting patient needs while matching staff skills and available resources. Focusing only on seniority, financials, or workload without considering patient care needs may compromise care. 8. Which of the following is a key consideration when making ethical decisions in nursing management? A. Prioritizing hospital policies over patient needs. B. Ensuring decisions reflect patient autonomy and informed consent. C. Following a strict hierarchy without considering patient needs. D. Making decisions based solely on financial constraints. Answer. B. Ensuring decisions reflect patient autonomy and informed consent. Rationale. Ethical decision-making requires respecting patient autonomy and ensuring informed consent. The other options prioritize institutional or financial considerations over patient well-being. 9. What is the best way to handle a situation where a nurse feels overwhelmed by their workload? A. Ignore the problem and continue working. B. Communicate the issue to the nurse manager and request support. C. Delegate tasks without informing others. D. Take a break and avoid addressing the issue. Answer. B. Communicate the issue to the nurse manager and request support. Rationale. Effective communication with the nurse manager ensures that support is provided and workload concerns are addressed. Ignoring the issue or avoiding communication may lead to burnout and patient care errors. 10. When delegating tasks to unlicensed assistive personnel, UAP, which of the following must be considered? A. The task is within the UAP's scope of practice and abilities. B. The UAP has more experience than the registered nurse. C. The UAP is willing to take on the task. D. The task is the least important and can be delegated. Answer. A. The task is within the UAP's scope of practice and abilities. Rationale. Delegation should be based on the task's suitability for the UAP's scope of practice. Experience, willingness, and task importance are less relevant compared to ensuring competency for the task. 11. What is an important aspect of patient-centered care? A. Focusing on the patient's physical needs only. B. Involving patients in decisions about their care. C. Relying on the family to make all care decisions. D. Limiting patient involvement to treatment plans. Answer. B. Involving patients in decisions about their care. Rationale. Patient-centered care involves active patient participation in decision-making, respecting their preferences and values. The other options limit patient involvement and are not reflective of holistic care. 12. How should a nurse handle conflicts within the healthcare team? A. Ignore the issue and focus on patient care. B. Address the conflict in a private and constructive manner. C. Allow the conflict to escalate to higher management. D. Only involve the healthcare team leader in resolving the issue. Answer. B. Address the conflict in a private and constructive manner. Rationale. Addressing conflicts early and constructively helps maintain a positive work environment and effective teamwork. Ignoring or escalating the conflict without attempting resolution is not optimal. 13. Which of the following is a nurse manager's responsibility in ensuring patient safety? A. Reducing staff numbers to save costs. B. Ensuring all staff are adequately trained and competent. C. Assigning the least experienced nurse to complex patients. D. Delegating all critical tasks to the nurse leader. Answer. B. Ensuring all staff are adequately trained and competent. Rationale. Ensuring staff are properly trained and competent is crucial for patient safety. Reducing staff or misallocating tasks can compromise care quality. 14. How should a nurse handle a situation where a family member insists on a treatment that is against medical advice? A. Follow the family member's request to avoid conflict. B. Encourage the family member to speak with the healthcare provider. C. Ignore the family member's wishes and proceed with the treatment plan. D. Delegate the decision-making to a healthcare team member. Answer. B. Encourage the family member to speak with a healthcare provider. Rationale. Encouraging family members to communicate with a healthcare provider ensures that their concerns are addressed while maintaining the integrity of the medical treatment plan. 15. Which of the following is the most effective way for a nurse to prioritize patient care in an emergency situation? A. Complete all routine tasks first. B. Address the most critical and life-threatening needs first. C. Delegate all tasks to other staff members. D. Focus on the patient with the least urgent needs. Answer. B. Address the most critical and life-threatening needs first. Rationale. In emergency situations, prioritizing critical and life-threatening needs ensures that the most immediate threats to patient health are addressed. 16. What is the role of a nurse leader in fostering a positive work environment? A. Enforce rigid rules without flexibility. B. Provide support, encouragement, and clear communication to staff. C. Prioritize administrative tasks over team well-being. D. Focus only on staff performance without considering morale. Answer. B. Provide support, encouragement, and clear communication to staff. Rationale. A positive work environment is fostered by supportive leadership that encourages open communication and staff well-being. Enforcing rigid rules or focusing solely on performance undermines morale. 17. What should a nurse do if they notice that staffing levels are insufficient to meet patient care needs? A. Continue working without reporting the issue. B. Immediately report the issue to the nurse manager or supervisor. C. Focus only on non-nursing tasks until the staffing issue resolves. D. Delegate all tasks to unlicensed assistive personnel. Answer. B. Immediately report the issue to the nurse manager or supervisor. Rationale. Reporting staffing issues to management ensures that corrective actions can be taken to maintain patient care standards. Ignoring the issue may result in unsafe care. 18. When a nurse receives conflicting orders from two different physicians, what is the best course of action? A. Follow the orders of the physician you trust most. B. Clarify the orders with both physicians before proceeding. C. Ignore the orders and proceed as you see fit. D. Ask another nurse to make the decision. Answer. B. Clarify the orders with both physicians before proceeding. Rationale. Clarifying conflicting orders ensures patient safety and reduces the risk of errors. Following one physician's orders without clarification could lead to harmful outcomes. 19. In resource allocation, how should a nurse prioritize care for patients? A. By assigning tasks based on personal preferences. B. By focusing on the most critical needs first. C. By addressing the easiest tasks first. D. By waiting for instructions from the healthcare provider. Answer. B. By focusing on the most critical needs first. Rationale. Prioritizing critical care ensures that patients with the most urgent needs are attended to first, maximizing positive outcomes and minimizing risk. 20. What is the nurse's role in ensuring patient privacy and confidentiality? A. Discuss patient information only with family members. B. Share patient information only with the healthcare team involved in the care. C. Share patient information freely with all staff members. D. Disclose patient information to the media for educational purposes. Answer. B. Share patient information only with the healthcare team involved in the care. Rationale. Nurses must ensure patient confidentiality by sharing information only with individuals directly involved in patient care. Sharing information without consent violates privacy laws. 21. What is the primary role of a nurse in coordinating care for a patient with multiple healthcare needs? A. To delegate tasks to other healthcare providers. B. To ensure that all care is delivered in a timely and coordinated manner. C. To provide direct hands-on care to the patient only. D. To supervise other healthcare professionals during care delivery. Answer. B. To ensure that all care is delivered in a timely and coordinated manner. Rationale. The nurse's primary role in coordinating care is to ensure that care is delivered efficiently and in a timely manner, involving all relevant healthcare team members. The other options focus on specific tasks, rather than the overall coordination role of the nurse. 22. How can a nurse advocate for a patient who is refusing treatment? A. Respect the patient's decision and leave the situation. B. Encourage the patient to follow the prescribed treatment plan. C. Explain the risks and benefits of the treatment options and offer alternatives. D. Ignore the patient's decision and follow the physician's orders. Answer. C. Explain the risks and benefits of the treatment options and offer alternatives. Rationale. Patient advocacy involves providing clear, detailed information to help patients make informed decisions. The other options do not support patient autonomy or advocacy effectively. 23. Which leadership style is most appropriate for a nurse manager when handling a crisis situation? A. Transformational leadership. B. Democratic leadership. C. Autocratic leadership. D. Laissez-faire leadership. Answer: C. Autocratic leadership. Rationale: during a crisis, quick decision-making and clear direction are required. Autocratic leadership provides structure and fast action, while other leadership styles may be too slow for urgent situations. 24. When should a nurse delegate a task to a nursing assistant? A. When the task is within the nursing assistant's scope of practice. B. When the task requires advanced critical thinking skills. C. When the task involves assessing a patient's condition. D. When the nurse is too busy to complete the task themselves. Answer: A. When the task is within the nursing assistant's scope of practice. Rationale: delegation should always be based on the task's complexity and the individual's scope of practice. The other options suggest inappropriate delegation practices that violate the scope of practice. 25. What is the most effective strategy for managing time when caring for multiple patients on a busy unit? A. Prioritize tasks based on patient needs and urgency. B. Complete tasks in the order they are assigned. C. Delegate all tasks to other healthcare workers. D. Focus on one patient at a time to avoid errors. Answer: A. Prioritize tasks based on patient needs and urgency. Rationale: prioritizing tasks allows the nurse to address the most critical patient needs first, ensuring patient safety and care quality. The other options either fail to prioritize or involve ineffective strategies. 26. Which action is essential when a nurse is managing a patient's care plan? A. Developing a plan that is based solely on the physician's orders. B. Collaborating with the patient and the healthcare team to establish goals. C. Implementing the care plan without considering patient feedback. D. Avoiding regular reassessments of the care plan. Answer: B. Collaborating with the patient and the healthcare team to establish goals. Rationale: collaborative care ensures that the plan is patient-centered and that all team members contribute their expertise. Other options neglect the importance of collaboration, reassessment, and patient involvement. 27. What is the primary responsibility of a nurse when it comes to resource allocation on a unit? A. To ensure that resources are distributed equally among all patients. B. To allocate resources based on the patient's ability to pay. C. To prioritize the allocation of resources based on patient needs and urgency. D. To consult with hospital administration for all resource allocation decisions. Answer: C. To prioritize the allocation of resources based on patient needs and urgency. Rationale: resource allocation should prioritize the most urgent and critical needs to ensure optimal care. Other options focus on fairness or non-prioritization, which could compromise patient outcomes. 28. When should a nurse consult with a healthcare team about a patient's care plan? A. Only when the patient's condition changes. B. When there are disagreements among team members. C. As soon as there is a concern or a change in the patient's condition. D. Only when a new member joins the healthcare team. Answer: C. As soon as there is a concern or a change in the patient's condition. Rationale: nurses should collaborate with a healthcare team whenever there is a change in a patient's condition to adjust care plans appropriately. Waiting for disagreements or new team members is not appropriate for patient safety. 29. A nurse is overseeing the discharge process for a patient with chronic health issues. Which strategy is most important? A. Discharge the patient as soon as possible to free up hospital resources. B. Ensure the patient has a follow-up care plan and understands medication instructions. C. Delegate the discharge process to a nursing assistant. D. Focus only on the physical aspects of the patient's care during discharge. Answer: B. Ensure the patient has a follow-up care plan and understands medication instructions. Rationale: a successful discharge process includes ensuring the patient understands their aftercare instructions, including medications and follow-up appointments, to prevent readmission. Other options fail to address the holistic needs of the patient. 30. Which leadership style is best for promoting staff development and encouraging team participation? A. Transactional leadership. B. Transformational leadership. C. Autocratic leadership. D. Laissez-faire leadership. Answer: B. Transformational leadership. Rationale: transformational leadership motivates and inspires staff to grow and engage in the decision-making process. The other leadership styles are more directive or passive, which may not foster as much team involvement or development. 31. What is an important step for a nurse when collaborating with other healthcare team members? A. Ensuring that all decisions are made by the physician. B. Establishing clear and open communication channels. C. Keeping information about the patient confidential, even within the team. D. Limiting input from non-nursing team members. Answer: B. Establishing clear and open communication channels. Rationale: effective collaboration depends on clear communication to ensure that all team members are aware of the patient's needs and treatment plan. The other options either undermine teamwork or hinder communication. 32. What should a nurse do if a patient requests information that is outside the nurse's scope of practice to provide? A. Provide the information to the patient and assure them it's correct. B. Refer the patient to a healthcare provider who can give accurate information. C. Tell the patient that the information is not important. D. Avoid providing any information and remain silent. Answer: B. Refer the patient to a healthcare provider who can give accurate information. Rationale: when information is outside the nurse's scope, they should refer the patient to a healthcare provider who can give the appropriate advice. The other options either provide incorrect information or neglect to follow proper referral protocols. 33. How should a nurse prioritize tasks when caring for multiple patients in a busy unit? A. Prioritize tasks based on the time they were assigned. B. Focus on completing tasks for the most stable patients first. C. Prioritize tasks based on the severity and urgency of each patient's needs. D. Complete the easiest tasks first to feel more productive. Answer: C. Prioritize tasks based on the severity and urgency of each patient's needs. Rationale: prioritizing based on urgency ensures that the most critical needs are addressed first, which is essential for patient safety. The other options do not consider patient urgency and safety adequately. 34. Which of the following best describes a nurse's responsibility in advocating for patient rights? A. Ensuring that the healthcare team follows only the physician's orders. B. Protecting the patient's privacy and ensuring informed consent is obtained. C. Deciding on the patient's treatment based on personal beliefs. D. Preventing patients from making decisions that may harm their health. Answer: B. Protecting the patient's privacy and ensuring informed consent is obtained. Rationale: advocating for patient rights involves ensuring privacy and informed consent, which are essential to respecting patient autonomy. The other options either undermine patient rights or involve unethical decision-making. 35. What is the most appropriate action for a nurse when delegating tasks to unlicensed assistive personnel, UAP? A. Ask the UAP to perform tasks that require assessment and critical thinking. B. Ensure that tasks delegated are within the UAP scope of practice and competency. C. Delegate all tasks to the UAP to free up the nurse's time. D. Delegate tasks based on the nurse's preference, not patient needs. Answer: B. Ensure that tasks delegated are within the UAP scope of practice and competency. Rationale: delegation should be based on the UAP scope of practice and ability to perform the task safely. Other options either overstep the UAP scope or lack patient-centered priorities. 36. Which action demonstrates effective resource management in nursing? A. Assigning tasks without considering staff workload or patient acuity. B. Ensuring there are enough supplies but not monitoring patient outcomes. C. Continuously reassessing staffing needs and patient conditions to allocate resources. D. Focusing only on staffing levels without considering patient care needs. Answer: C. Continuously reassessing staffing needs and patient conditions to allocate resources. Rationale: effective resource management requires ongoing reassessment to ensure that care is properly allocated based on patient needs and staff availability. Other options do not consider the dynamic nature of patient care. 37. How does a nurse demonstrate leadership during a code blue situation? A. By waiting for the physician to take charge of a situation. B. By directing the team and ensuring effective communication. C. By stepping back and letting the experienced team members handle the situation. D. By delegating all roles and not participating actively. Answer. B. By directing the team and ensuring effective communication. Rationale. During an emergency, a nurse leader must take charge, direct the team, and ensure clear communication to ensure that all necessary actions are taken promptly. The other options do not provide the necessary leadership in such critical moments. 38. What is an essential part of a nurse's role in advocating for a patient's cultural beliefs? A. Ignore cultural beliefs if they interfere with treatment. B. Respect and incorporate the patient's cultural values when planning care. C. Require the patient to change their beliefs to follow medical advice. D. Assume all patients from the same culture have the same beliefs. Answer. B. Respect and incorporate the patient's cultural values when planning care. Rationale. Nurses must respect cultural diversity and ensure that care plans accommodate patients' beliefs and preferences. The other options either neglect cultural sensitivity or make inaccurate assumptions about cultural beliefs. 39. Which of the following is a key component of promoting teamwork in a multidisciplinary healthcare setting? A. Working independently, without consulting other team members. B. Focusing only on individual patient tasks and neglecting teamwork. C. Ensuring open, clear, and respectful communication with all team members. D. Expecting other team members to follow the nurse's instructions without discussion. Answer. C. Ensuring open, clear, and respectful communication with all team members. Rationale. Effective teamwork requires open communication, respect, and collaboration to ensure coordinated care. The other options either isolate the nurse or undermine the teamwork process. 40. What is the nurse's role in coordinating patient care with other disciplines? A. To independently make all decisions for patient care. B. To ensure that communication between disciplines is clear and effective. C. To defer all decisions to the primary physician. D. To limit communication with other disciplines to avoid conflicts. Answer. B. To ensure that communication between disciplines is clear and effective. Rationale. Clear communication is essential for coordinated care, ensuring that all team members are aligned with the patient's care plan. The other options either overstep boundaries or hinder collaboration.